Welcome to today's press briefing. Today we have Dr. Chang Shuk Kwan from the Center for Health Protection and Dr. Linda Yu from the Hospital Authority. Dr. Chang will provide us latest update on COVID-19. Last night we have confirmed 61 cases. Case number 9869 to 9929. 33 male and 28 female, aged between 5 to 90 years old, 16 of which were picked up at temporary testing centers, 11 from Yamate Kunchong or at mobile specimen stations, and 1 from Samshui Po, as well as other areas. Of the 61 cases, 6 of which are imported cases. 55 were locally transmitted cases. From the local cases, 26 of those are of untraceable origin so far. 13 of those lived in Yaochunwang district, and in which 5 of the cases came from the specified Jordan area. 29 cases are related to other cases. 1 case from Chongqing Lam-Tin Tunnel cluster close contact and diagnosed in the quarantine center, and 28 cases are related to other cases. Altogether, of the 55 cases, 24 of those lived in Yaochunwang district. 8 of those lived within the specified testing area. In Samshui Po, within the specified area, let me check. I need to check further. For the buildings, there are a few buildings to be subjected to compulsory testing. For those with 2 units in the same building, there are 4 buildings. That's just a tentative figure. Chongqing O, the Grandiose Block 3, 2 units, different, same direction but different floors. 1 unit with 2 confirmed cases, another unit with 1 confirmed case. The second building, and Verbena Heights in Chongqing O Block 3, 1 case per unit. They are on the same floor but don't know each other. The third building, Castle Peak Road 221 to 213, Healy Building. 2 units with 1 case each. They share the same floor with different units, and they are not acquainted with each other. 4th building, Xunwan Yan Chui Street, Yit Chui Court. 2 units with 1 case each, on the same floor, but not acquainted with each other. For Yamate, within the specified area, compulsory testing area, we have 2 units. 1 building is Battery Street number 35. 1 unit with 1 cases. And Yamate Battery Street number 66 to number 70 Kaiyi Court. 1 unit with 1 case. In Samshui Po, specified compulsory testing area, Tainan Street number 260. 1 unit. And 95 Quailin Street. 1 unit with 1 case. So we have 2 cases from Samshui Po residents. In another building, and Park Street number 98, Kingsway Plaza. Previously we have a 2 unit with cases and they are facing the same direction. Today we have 3 more units. Kensington Plaza, 2 of which facing the same direction. Another unit shared the same floor with an earlier case. So altogether we have 4 units facing the same direction, the unit C. And this afternoon, our colleagues and departments and experts have visited the Kensington Plaza to check for any risk of vertical transmission. And that's the end of today's report. And Dr. Yu will talk about the HA situation. As of today, 9 a.m., in the past 24 hours, the hospital authority have reported a total of 83 cases. A 66-year-old female patient with a chronic disease, case number 8937, passed away on 12/49. The patient received treatment at PMH and later confirmed with COVID-19. And together with this patient, currently we have a total of 164 cases passed away in public hospital. In the past 24 hours, we have another 45 patients recovered and discharged, bringing a total of 8,949 patients recovered and discharged. 718 patients are currently scattered in 24 public hospitals and the Asia the World Expo community treatment facilities. 34 in critical condition, 30 in a serious condition, 694 in a stable condition. The negative pressure beds stand at 1,204, utilization at 66.6. Negative pressure wards stand at 676, utilization at 74%. And at the Princess Royal Hospital, a patient care assistant worked at the staff clinic, and due to fever, she sought medical attention at the clinic and tested preliminary positive. The infection control team conducted contact tracing. The last day of work of the colleagues, 20th of January. The case mainly helped the healthcare staff take care of the patients and did not take care of confirmed cases. While at work, the case wore appropriate PPE and no patients are classified as close contacts. 3 colleagues who shared meals with the case are classified as close contacts and need to undergo quarantine. The staff outpatient clinic suspended today for thorough disinfection. Once again, we remind our colleagues, whether at work or after work, they should refrain from sharing meals together, or they should eat at separate times to avoid transmission. And for the latest PPE inventory figures, as of today, the surgical mask stand as 81 million. Respirator at 7.4 million, and face shield at 9.8 million, and protective gown at 11 million. The level of PPE able to sustain for 6 months. That's the end of my report. We're now open for the questions, and please state the media organization and speak through the microphone.
Please introduce your organization before you ask your question. Now TV. For the Yamate and Jordan specified area, will there be a lockdown? You have so many buildings subject to mandatory testing. Is it too late now for the lockdown? For 15 to 27 Pitt Street, are there any new cases today? There have been 37 cases previously. Why is it that you're not organizing evacuation for the residents in those buildings? And also, what is the number of preliminary cases today? Preliminary confirmed cases, I think we have more than 50. Regarding lockdown, I don't have anything further to add. As for Pitt Street in Yamate, we have 1 confirmed case today. We are looking into this particular case because the buildings have subdivided units, so we'll check again, because sometimes it's difficult to determine whether or not the unit is a subdivided unit. So we will make arrangement for the those in living in the subdivided units and send the residents to the quarantine centers. Any other questions? The last row. Lady in green, Ming Pao. I'd like to ask a question regarding Pitt Street. So what will you be looking for when you go there today? Will you be looking at the pipes? Why is it that in the last few days there have been many confirmed cases? Have you made any assessment regarding the risk of an outbreak in that area? And yesterday the Food and Health Bureau had a press release saying that there are 3 negative cases in the Yau Chim Mong area. For these 3 false negative cases, the gentleman Dilly had 3 of his family members who have been confirmed. Are there any other related cases as well to this one? And in the Yamate area, how many false negatives have been found out in the Yamate district, and where were the tests taken for those cases yesterday, and which was the contractor responsible for those tests? We're going to the Kingway Plaza, the Kensington Plaza, to look at the pipes and see whether or not it is the cause of the transmission. Regarding the F&H Bureau's press release, I don't have anything further to supplement, and I don't know anything about the persons you interviewed because personal privacy is involved here. Regarding Pitt Street, there are many cases which involve subdivided units. So whether the subjects live in subdivided units, and whether there are others, share the same subdivided units that we have not yet been able to identify, we will send them to the quarantine center. Regarding the pipes or the drains, they're not within our jurisdiction. Basically, it would be the buildings department's responsibility. Next. Hong Kong 01. Regarding lockdown, in terms of prevention of epidemic, so what purpose does it serve for you to lock down a district? Some experts have already said that the pipes in buildings are also could be problematic, and a few days ago the samples taken from the buildings in the Jordan Yapading district have found traces of the virus. So is it a good choice is it that is it better that you should recommend evacuation and after the lockdown, what will be the arrangements? Has the government considered the daily needs of the residents? For example, if the shops and the restaurants are not open, how can the affected residents buy their daily groceries? Some residents are also worried that some of the people in the district have already left the district, and would there be a risk that the virus would have spread already to other districts? In the specified area, many of the buildings have already been subject to compulsory or mandatory testing. What is the number of the residents who have taken the test? And if we want to conduct another round of testing, how effective would that be, and would it be cost effective? Also, you said that in Sam Shui Po, you have also found some cases in the specified areas. In the specified area, how many residents have already been tested? I do not have such information offhand, but I understand that the Home Affairs Department sometimes would issue press releases regarding the specified units and the resident buildings and how many residents have been tested. perhaps you can refer to the press releases. I don't have anything further to add as to whether or not we need to have lockdown. Sorry, this reporter is not speaking at the microphone. Now, regarding the sewers pipes and the cases that we have identified, for every building, assuming that there's a confirmed cases in the building where you live, some of the sewers could have gone into the pipes. The Hong Kong University has already taken some samples from those pipes. If the tests turn out to be positive, even if therefore there is no confirmed cases in that building, there could still be some silent, asymptomatic patients living in that building. So if we can find, positive, samples from the pipes, it doesn't mean that that there would be positive cases in the building. I'm afraid I'm not able to answer that question. Next question.
The first one is for the building in the Parker Street. Is it covered in the mandatory testing zone? And why a vertical transmission is suspected? And will the residents be sent to be quarantined? And the second question is about, because in recent days there have been cases in Yau Tsim Mong district. Do you think that residents there have to go through a second mandatory test? Thank you.
For the Parkin Street, the Kensington Plaza is under compulsory testing building. Yeah, because there's a significant vertical distribution of the cases. That's why there's a site visit to be planned today to see whether there's any factors that may facilitate those transmission. And for the second round testing, I think it depends on the latest situation and the number of cases in the coming days, and including the sewage, etc. What kind of resident? You mean the Parkin Street? It depends on the result of the site visit of the conjoint team. Yeah, later on. We can't exclude according to the past experience.
好，下一位我哋答多條英文問題嗰邊。
Good afternoon from SCMP. I just want to check, will the government give a one-off amnesty for, people without any papers or Hong Kong ID to take the test, the COVID-19 test in Yau Tsim Mong district? Because it is said that maybe some ethnic minorities or some people have avoided testing because they don't have their identity official papers to avoid getting caught. And secondly, also with people getting infected from Dubai as they fly from the UK, is it possible that will the government consider, maybe looking into Dubai to see if maybe flights will be banned in the future, things like this? Thank you.
You mean Dubai, right? I think Dubai satisfy the criteria of getting. I mean, we need a test result as well as a 21-day hotel booking. I mean, but we still have some procedure to undergo to formally announce. Yeah. And what's the first question is.
Talking about will the government give a one-off amnesty for people without any papers or any Hong Kong ID to take the COVID-19 test? Because it is said that some people have avoided testing to avoid getting caught by authorities because they don't have HKID.
I think as long as they come forward for the testing, I don't think the testing center or even those free testing bottles, they can get them and send in the bottles. Yeah, but of course I can't promise any if there's any legal followings, right?
下一位嗰邊第
In the third row, the middle. Cable news. I would like to ask about the Yau Tsim Mong lockdown. we received news that the area will be sealed off. May I ask Dr. Chung, as the analyst for the epidemic, how do you gauge the effectiveness of the lockdown in curbing the epidemic? Will the lockdown and the lifting left a lot of unresolved matters, for example, poor environmental hygiene and sewage problems? Looked at the confirmed cases, and 2 days ago that the confirmed cases within and outside the area make up half and half, and yesterday the outside the area make up 55%, and today you see more cases outside the area. Would you see that the transmission already spread beyond the specified area and not just limited to the neighborhood? So would you see that the community testing as diminishing? Yesterday there are 3 cases from negative to positive that actually performed by KingMed and also Hong Kong Molecular Pathology Diagnostics Center. Will the government consider appointing other contractors? Well, the hotspots are currently contract to these 2 contractors, and would there be other cases that were undetected? I will not comment on any kind of rumors. As for whether a smaller neighborhoods or bigger community, the epidemic situation, for example, today we have 61 cases, 13 of which, or 26 rather, are of untraceable origin, half of which picked up in Yau Chim Wang, the other half from other areas. All along, not all the cases are from Yau Chim Wang. There are plenty of cases outside Yau Chim Wang. In Yau Chim Wang specified compulsory testing area, we have 5 cases, and we still a lot of cases beyond the area. It's just within the specified area we found there are more cases concentrating, which require more work to be done. It all depends on a total case tally and so on. And for the cases within the specified area, of course, we will do more. But it doesn't mean that there are no cases outside these specified areas. For these cases, we will be as careful as usual. And for 1 building or 2 buildings, or for all buildings and 2 building cases, we'll conduct compulsory testing. The Food and Health Bureau have issued a press release to respond to the inquiries on the false positive case. Sometimes a negative test result followed by a positive test result. This is not unusual, even in a hospital or in other settings. This happens regularly, and we invite Professor Yun and other experts to see do we need to do any follow-up to dispel or to assure the public. In the second last row. Hong Kong Economic Times. Yesterday, there was a nursing home with 1 resident confirmed. Do you have a case number? And have you found out the infection source? Other residents and staff confirmed as well. At Kensington Plaza, you suspect a vertical transmission. How many cases altogether, and how many cases in each unit? Third question, and for Charming Garden Block 2 is subject to mandatory testing. The HAD claimed it will not hand out specimen bottles or set up a mobile testing station, but order them to get tested within 3 weeks. Would you consider handing out bottles in the area to facilitate testing? And question for HA. At the North Hospital Isolation Ward at Tuen Mun Medical or Geriatric Ward nurse, do you know their infection source? And for the Princess Margaret Hospital nurse prelim positive case, do you have a case number or the infection source? And also the infection source for the Princess Awell Hospital case. The Elderly Center, the case number is 9911. Kensington Plaza, 5 units, 4 of the units at Unit C. 1 of the unit with quite a number of cases, 6 cases. The other 3 units C with 1 cases each, and 1 case on the same floor. Altogether in Kensington Plaza, the confirmed cases 10 from 5 units. Speaking on the mic. We yet to report any similar cases. We need to look for more clues, otherwise it could be untraceable. It seems there are visitors. For the North District Hospital Nurse, the epidemiological investigation is still underway. At the Queen Elizabeth Nurse, we speculate it may relate to the North District Hospital Nurse. At the Princess Margaret Hospital Nurse, and that case had a family member confirmed earlier, which we believe the infection source is from the community. And the Prince of Wales Hospital, the patient care assistant, we are conducting contact tracing. Speaking on the mic. For the Princess Margaret Hospital case, the case number is 9869. Speaking on the mic. I don't have details about the exact arrangements. Besides going to a mobile testing station, Gage could get the specimen kit at the general outpatient clinics. Apple Daily. At the Kensington Plaza, you said there are 10 confirmed cases. Can you provide their case numbers? Of the 5 units involved, how are they scattered? Are they from high, middle, or low floors? Which unit at the start first? Is it going upwards or going downwards, the transmission? And for the Princess Wales Hospital patient care assistant, where does the case live? And does it come from Samshuipo or the Yaoqingmou district? So do you see there's a case of in-hospital or community infection? For Kensington Hospital, we wait for Professor Yoon and the expert to conduct a site visit. As I'm not at the scene, I cannot say there were any transmission risk and so forth. And we shall upload the case number to the building list later tonight. The Prince of Wales staff, as far as I know, the case did not live in any compulsory tested buildings, and the case worked at the staff outpatient clinic and do not interact with confirmed cases. I believe that the risk of contracting the virus in the hospital is quite low. We're still doing investigation. If there are any questions, that's the end of today's press conference. Thank you for coming.